This is 48 years old male with diabetes type 1 and almost complete laser PRP. Then you see that proliferations are not that firm as usually. We have just removed the proliferation from the optic disc, and we collect the blood, and after that we will proceed with the diathermy and remove the proliferation using flute needle with silicone tip. In the nasal pile, however, there is some dense and firm proliferation connection, and we cut it with scissors. In the meantime, we made the iatrogenic tear nasal to the optic disc, if you see, very close to the proliferation, and local retinal detachment occurred. But this is not going to be a big problem for this case. Patient suffers the severe PDR with vitreous hemorrhage and had the neovascular glaucoma in the other eye and is monocular. That is the reason that we did 2 surgeries. The first one, this one, with phaco vitrectomy and completing of the laser in periphery and silicone oil injection due to this. Now it's very clear nasal of the optic disc, this iatrogenic tear, which is now diathermized, and we proceed with peeling. And as I said, the second operation was silicone oil removal, which was successful. Preoperative visual acuity was counting fingers 2 meters, and postoperative visual acuity 0.1. The left eye had no light perception. After removal of entire proliferation and collecting the blood with vitreous cutter and removing the last part of the proliferation, so that we completed en bloc excision, we continued with the completing of panretinal photocoagulation. You can see now bimanual removal of the rest of the proliferation along the lower temporal arcade. It is very essential to stop all the bleedings and potential risks for reproliferation, which we do meticulously with endodiathermy, because it is very unpleasant complication if some bleeding occurs under the silicone oil. Even if a minor bleeding occurs after surgery, it is advised not to remove it, but to wait, because smaller bleedings will disappear by themselves, and larger bleeding can be removed after 2 weeks when the blood is fibrinolized. Now the mellitus endodiathermy in all connections and feeding vessels. Retina is slightly detached in the nasal part, nasal of the optic disc, and after this cleaning we proceed with the focal laser around retinal proliferations, around those connections where proliferations were before the removal, and then we proceed with completing of panretinal photocoagulation anterior to equator with self-indentation, which is, as I mentioned before, one of the big advantages of bimanual work with chandelier light that we use. we tend to do the endophotocoagulation until the ore serrata and diminish the risk for reproliferation and neovascular glaucoma like the patient had in the other eye. After that, we proceeded with silicone oil injection, which was, as I mentioned, successfully removed before.